Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Addenbrooke's cognitive examination assesses multiple cognitive domains including attention, memory, verbal fluency, language, and visuospatial abilities. Its main purpose is to aid in the detection and differentiation of neurodegenerative disorders such as Alzheimer's disease, frontotemporal dementia, and other forms of dementia. The tool provides a comprehensive evaluation of cognitive function, contributing to the early diagnosis and monitoring of cognitive decline. It is widely used in clinical settings due to its sensitivity and specificity in identifying mild cognitive impairment and dementia. The Addenbrooke's cognitive examination is indicated for adults undergoing cognitive assessment, particularly those suspected of having dementia or mild cognitive impairment. It is most useful in clinical contexts requiring detailed evaluation of multiple cognitive domains, including attention, memory, language, visuospatial skills, and executive function. The tool aids in differentiating between various types of neurodegenerative disorders, such as Alzheimer's disease, frontotemporal dementia, and Lewy body dementia. It is also valuable for baseline cognitive profiling prior to interventions or longitudinal follow-up in memory clinics and neurology settings. The Addenbrooke's cognitive examination consists of 125 items divided into 5 domains: attention and orientation, memory, verbal fluency, language, and visuospatial abilities. The assessor begins with the attention and orientation section, which includes questions such as the date, location, and immediate recall tasks. Responses are recorded as correct or incorrect. The memory domain follows, involving tasks like delayed recall of words, recognition, and learning trials. Verbal fluency is assessed by requesting the patient to produce as many words as possible within a minute, starting with a specific letter. The language section comprises comprehension, naming, repetition, and writing tasks, assessed through verbal or written responses. Finally, visuospatial skills are evaluated using copying tasks and clock drawing, scored based on accuracy and completeness. Each item receives a score that is summed to generate domain-specific and total scores, with a maximum total of 129 points. Scores above 86 are typically considered within normal limits for individuals aged 50 to 85 years. Scores between 72 and 85 may indicate mild cognitive impairment, whereas scores below 72 suggest more severe cognitive dysfunction. Domain subscores help identify specific cognitive deficits. The examiner must consider factors such as education level and cultural background when interpreting results to ensure accuracy. The sensitivity of Addenbrooke's cognitive examination typically ranges from 85% to 95%. Indicating the test's ability to correctly identify patients with cognitive impairment. Specificity values generally fall between 80% and 90%, reflecting the test's capacity to correctly classify individuals without cognitive impairment. Sensitivity measures the proportion of true positives detected, meaning that if 100 patients have dementia, the examination would correctly identify 85 to 95 of them. Specificity measures true negatives, so if 100 individuals do not have dementia, the test would accurately exclude 80 to 90 of these individuals. In clinical practice, a high sensitivity reduces the chance of missing a diagnosis, while high specificity minimizes false positives, guiding appropriate patient management. The Addenbrooke's cognitive examination was originally developed in the late 1990s as a comprehensive screening tool to detect cognitive impairment and differentiate between various types of dementia. Its validation involved comparison with the mini mental state examination and clinical diagnoses based on established criteria for Alzheimer's disease and other neurodegenerative conditions. Early studies by Miyoshi and colleagues demonstrated that the test exhibited high sensitivity, reported as approximately 98%, and specificity near 85% in distinguishing dementia cases from healthy controls. Subsequent research expanded the validation across different populations, confirming its utility in detecting mild cognitive impairment and frontotemporal dementia. Structural analyses of the test confirmed good internal consistency, with Cronbach's alpha values exceeding 0.8, indicating reliable subdomain measurements of attention, memory, language, fluency, and visuospatial abilities. Cross-cultural adaptations and updated versions have undergone rigorous psychometric evaluations, consistently supporting the examination's robust diagnostic accuracy and clinical relevance in diverse settings. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.